An ankle sprain is the most common sports-associated injury. It's probably the most common injury I treat for the foot and ankle. One study showed that 10% of all emergency room visits are ankle sprains. Up to 50% of the time there will be a long-term problem that occurs after a sprain. There are 3 different grades: mild, moderate, and severe. The severity doesn't always correlate with the grade of the sprain, and so what may seem like a very minor injury can end up being a very big problem. Injury has occurred to the ligaments, and sometimes there's a partial or complete tear. A ligament connects bones to bones, and so this can affect the stability of the ankle. Many different types of injuries can occur when we talk about a sprain, but the most common is an inversion injury when the foot and ankle turns in. Sprains can be devastating because a long list of possible injuries can occur to the bone, the joint cartilage, nerves, tendons, and even soft tissues. The symptoms that occur include pain at the injured ligaments, swelling, bruising, inability to bear weight, and even numbness. In terms of the treatment, RICE is a common acronym that refers to rest, ice, compression, and elevation. A brace or boot can be used for a period of time, sometimes crutches, but gradual movement is encouraged. Eventually people get back to low impact exercise, and I often follow ankle sprains over a period of time to make sure that another problem doesn't develop. Frequently physical therapy will be needed as well. If a patient suspects that they're dealing with an ankle sprain, then I would recommend an evaluation by a board-certified orthopedic foot and ankle specialist.